This is a brief podcast about the National Centre for Rural Health and Care. I'm Ivan Annable, Director of Operations at the National Centre, and I'm preparing this podcast on behalf of Dawn Bloodworth. The National Centre for Rural Health and Care was established in 2017, initially as the personal commitment of Jan Sobieri, who was then Chief Executive of the United Lincolnshire Hospitals Trust, to look at trying to address how rurality impacts on the delivery of health and care in England. He had applied experience of this in seeking to deliver services across 3 small hospitals spread over a very large, in England terms at least, geography. And so with some funding he managed to generate from local charities, we held a symposium in 2017 to which 80 different organisations attended, and a clear commitment arose from that for people to work together to think about a formal structure to address the issues that arose from that symposium. We then formed a community interest company and recruited a board, and the chair of the board is Professor Richard Parish, who until very recently was a board member of Public Health England with their rural brief, and is extremely well networked across a whole range of health settings. He's former chief executive of the Royal Society of Public Health and a number of other different bodies, and participates in a whole range of different activities at a UK-wide level. But also on the board is Jan Sobieri, who's Deputy Chair, but then we also have Graham Biggs, who is Chief Executive of the Rural Services Network, which is our key rural services lobby group for local authorities in England, Professor Mike Hannay, who's Chief Executive of the East Midlands Academic Health Science Network, which is one of a network of 13 academic health science networks set up by the NHS to identify innovation and help scale it up and get it adopted where it can make a difference to service delivery. We've got Dr. Rashmi Shukla, who's Director of the Midlands and East at Public Health England. We've got Debbie Freak, who is the Director of Strategy and Integration at Northumberland Healthcare Trust. We've got Professor Libby John from the University of Lincoln, who's leading the establishment of the new medical school there. We've got Professor Wyn Jones, who's a time-served GP from Wales originally, but now living in Shrewsbury, and who has a really extensive global perspective on these issues through his membership of the board of an organisation called WONCA that operates particularly in developing countries. And we also have a number of key supporters that are on a wider steering group, including representatives from organisations like the NHS Confederation, our local enterprise partnership in Lincolnshire where we're based, and a number of other organisations and supporters that have got particular interest. We also have a membership scheme where members pay £500 to be a member, and we do that jointly with the Rural Services Network. It's called the Rural Health and Care Alliance, and we have 60 members stretching in the southwest from Cornwall, where the Royal Cornwall Hospital Trust is a member, right up to Wooler near Berwick-on-Tweed, where Rob Lambourne, who's the chair of the Rural Committee of the Royal College of GPs, represents them as a member. That gives us a national reach and credibility, but it also gives us some useful income. We split the income with the RSN, but that's a guaranteed 15 grand a year for us, and it will grow as time goes on. The reason we chose to be a CIC was that does make us grant friendly as well. Organisations like the Community Fund in England, which is our biggest bit of the national lottery, will provide grant aid to CICs, although we haven't flexed our muscles on that yet. In addition to those elements of our operation, we have 4 key themes that we operate in. The first theme is workforce, which is the biggest issue we face, and recruitment and retention and training are all huge issues in that context in rural England. We've commissioned, with funding from Health Education England, a research report from the University of Birmingham led by Professor Anne Green. It's on our website, which has looked at this in some detail. And it's enabled us to feed into, in England, Baroness Harding's interim people plan, which is part of the development of the long-term plan in England. and also led to us being invited to speak at the Civil Servants Summer School about key workforce issues, which we're doing next week. The second area is research broadly, and in relation to that, we're looking to harvest information from the global level downwards, which gives us a series of insights about how to best address issues in rural health and care. We've also got some funding that we've been able to generate, which enables us to commission some of our own research, and we've commissioned research from the Nuffield Trust. In England, we don't in the NHS use the term rural, which is regrettable. Because of kind of funding policy wonks, we have this term which describes the most remote places as being unavoidably small due to issues of remoteness. And there are 7 acute trusts in that category, and they account, interestingly, for 23% of all debt in the acute sector, and that's largely because of the challenges they face around workforce. And we're commissioning some follow-up work, some follow-up research in the context of that. But we're also Kay Pearl, who is one of our key secondments from Bishop Grosseteste University, is pulling together a digest of different areas of key research more broadly, and we're also working through her with our 60 members to get their insights to build the research side of what we do. We've got a data and insight strand, and we're working particularly with Public Health England around that. They have 2 different online systems that provide health data, and we're looking at how they can be customised to better meet the needs of people who want a quick overview of rural health inequalities. We're also in a dialogue with the University of East Anglia, because they've done some really interesting work to look at how the English indices of deprivation, and I know you've got your own version of the IMD in Scotland, have an urban bias, and there's some really interesting work emerging around all of that. And then the final strand of work that we're really heavily involved in is around technology. We got the Academic Health Science Network to sponsor an innovation exchange for rural at the showground in Lincoln on the 6th of December last year, and that identified 300 people came to it, a significant number of technology-facing businesses, and it identified 3 really strong ideas that with further investment could help to address some of the issues we've identified from a rural perspective. And so they're being worked up at the moment with support from the AHSN. In addition to those things, we're also involved in a parliamentary inquiry into rural health and care where we provide the secretariat. And that's really helpful in that context because it's co-chaired by Anne-Marie Morris MP, who's a Devon-based MP who campaigns on health issues, and the Bishop of London, Dame Sarah Mullally, and she's interested because she was formerly suffragan Bishop of Crediton in Devon, but also chief nurse before that. And those 2 connections and the different people we've had along to give evidence have got us into a really good position with the Department of Health and Social Care in England, who've said that they will use the outcomes of our research, which will be published in Hansard, to provide a rural lens for the implementation of the long-term plan in England, which is, we've got to follow up on that commitment, but if they make good on what they've said in principle, that will make a huge difference from our perspective in terms of impact. So the other thing we're doing, and this is part of thinking about our longer term income, so we've got the membership base, we've got grants, we'll continue to need grants in the short term, but in the very longer term we want to be a bit more independent, is developing a rural health proofing toolkit. And we think that will be saleable. We're doing that with the RSN, and we've got some input from Nuffield. We're just starting that. And we think trusts and others might be interested either in buying some support from us to implement it or just buying it as a tool they can use themselves to help improve their effectiveness through taking account of rural issues. So that's key. And we do see scope for collaboration around research, particularly bidding and delivering work with third-party organisations, particularly our members. So I hope that gives you at least an initial overview of what we're about, what we're up to, where we've come from, and where we're going. We've got a website, and if you Google the National Centre for Rural Health and Care, you can get the information you need about us there. I should also mention that we've commissioned 2 bits of action research, well, 3 actually, at the very local level. And we're going to develop those as good practice notes. One is about an innovative approach to the accreditation of GPs in Herefordshire, working with the Acute Trust there. One is around the challenges that dispensing doctors face. And we're working with the Dispensing Doctors Association in England around that. That's doctors' surgeries that also have pharmacies nested in them. And a third one is looking at the relationship between the co-op pharmacy outlets in Lincolnshire and our first responder service, in terms of the first responders training the pharmacists in advanced first aid, with a view to enabling them to provide greater support to people that they see directly. So that's where we are. I hope this has been useful, and Diane has my details and can pass them on if anybody would like to talk to me about anything I've said in more detail personally.